Welcome to my podcast. Today I'm going to raise up another topic, and it's very important. And obviously, it's on the increase. So the patient will come to you, and after you introduce yourself, as we always agreed, double check the patient name, date of birth. The patient might feel like embarrassed or have seen a leaflet or a poster or had some health issue, and she wanted to see what option the patient has in order to tackle this problem. So the patient, I basically either they are like overweight or obese, and the patient want to explore the possibility of the options that can be offered. So obesity is a major public health problem, and it's with a forecast on the increase in the next coming year. It's quite significant problem in the UK, and it has been estimated that 28% of the population are obese and 36% are overweight. And the projection suggested by 2050 that 60% of men and 50% of women and 26% of those under 16 will be obese. Obesity is kind of linked to health inequality, and it has been stated that those kind of health inequality, basically like lack of education, low household income, and it's more prevalent in certain ethnicity of minority. And as we all know, the complication around that, it's diabetes mellitus type 2, vascular disease, asthma, and several cancers. And of course, the pressure and the weight on the knee. It has been stated that life expectancy will decline as the BMI, which is the body mass index, on the rise, and especially when it's fall between 30 to 35 by 2 to 4 years, and if it's more, it will raise until 10 years, and that's in the condition when the body mass index is more than 40 kilogram per square meter. And as I mentioned, the commonest problem because of the excessive weight is the knee pain, which will be exaggerated. And the NICE guideline in January 2025 draw certain guideline in regard obesity and how it can be tackled and what option is present. In the Canadian system, they have devised like 5 A's, which is ask, assess, advise, agree, assist. So you can't just say to the patient, oh, you are quite obese, or embarrass them, or obviously they know that they have a problem, but you need to see what can be done, especially if the patient comes seeking for help. So you could ask, what's the problem? What's that you feel that you need to do? Have you tried before? Stuff like that. And talking also about the social and economical and environmental influences, all of that play a major role. And as we all know, when it comes to the food, basically those ultra-processed and with the additive, they're quite cheap, tempting, whereas the healthy food is kind of expensive, especially when it comes to organic things. So we need to assess and inquire about the behavior in order to intervene. And it's been stated that physical activity, you have to have a physical activity no matter what, even if you are not losing weight. So part of the story that you need to keep active, move, even if you're not losing any weight, because that's what we need people doing. So physical activity, overall, it has, of course, health benefit, and it will reduce the risk, of course, of type 2 diabetes mellitus and cardiovascular risks. And it's been stated that we need to aim for at least 600 kilocalorie day deficient for weight loss. And those promoted restrictive diet regime proven to be ineffective in the long terms. And when it comes to the pharmacological intervention, in May 2025, the only prescribable option in the primary care setting is Ariostat, which aims to lose like 5% of the total body weight. However, for those who are hyperglycemic but are not diabetic and have certain cardiovascular risk, the specialists offer GLP-1 agonists like liraglutide and semaglutide. However, the new one, as we all know, which has a famous name, Manjaro, is tirazepatide. It has a dual action, so it's basically incorporating GLP-1 and GIB, and both of them are agonists, and they are approved by the NICE guideline in the primary setting. So the patient who's attending the specialist weight management are offered the new, this one, the tirazepatide, because since 24 March 2025, it has been stated it's funded by the NSH for those with the high body mass index, which is more than 35 kilogram per square meter. And of course, it should be adjusted to a certain ethnicity where appropriate. The drug is not OTC, but is provided currently by the private route. However, for each part of England, it has its own ruling. So what's applicable in one place is not applicable in the other place. Say, for instance, in Wales, it's more than 45 kilogram per square meter, whereas in Scotland, it's differ from Ireland and the rest of England. And when all of those measures fails, or the patient has high body mass index, which is more than 40, or it could lie between 35 to 40, they're going to offer barometric surgery. And of course, it's not a simple operation. It needs multidisciplinary approach and agreement with a long-term follow-up, at least for 2 years. And it's not like certain people think this is the only solution, because weight regain is not uncommon, which means it can happen again, where in those kind of situation you had this surgery, which of course involve some resection of the tummy, of the stomach, and colon, certain bypass. And all of that will have their long-term implications, for instance, malabsorption and certain vitamins that you need to take for life. So it's kind of complicated. It's not easy, straightforward. You just need that you have to motivate yourself and have the courage to be active and proactive in order to decline to some extent the weight exists. I hope by that I just give you like a briefing about obesity and it's a public major issue in the UK, and how and what options do we have in order to tackle and try to minimize this issue. Thank you.